Hi guys,
Hey, Dom.
how you doing?
Good. If this is you, who's under Dom? Is it Noktula?
I have no idea. Which one is me? Oh, I'm the unmuted one.
Yeah.
Hi, Tom.
Oh, that's Noktula.
No, it's Esther.
Can you guys hear me?
Is that Nogutula? Yes?
Yes.
How's it?
Good, good.
Good.
Tell me, who are the panelists? Have they already joined in? Have they already jumped in?
So I'm going down to the boardroom now and I'll see who's there. But the panelists,
The actual boardroom downstairs.
like the actual boardroom downstairs.
Okay. So are they gonna be here physically?
So it's going to be myself. We'll all have our own computers, I think, because that makes sense. But I booked the boardroom because it's quieter than the office. So that's just the reasoning.
So are
And
you gonna be in the boardroom by yourself? Because then
So-
if there's like 3 of you guys and you all jumped into one meeting,
No,
we might have some feedback issues or some echo on the background.
100%. I'll have to check who's there.
Okay.
Okay.
But I'm heading down there now.
Noktula,
Okay,
you
cool.
are now the primary host. Dom, you are now the co-host because you're moderating.
Okay.
Just check there. I think I saw that Sia was actually online. You could just please admit him.
Okay, cool. But another thing, so Justin is wrapping up a meeting. I'll make him a co-host so that I'm able to share my screen. So did you see there was a resting slide that was
Yeah.
written
Yes.
welcome, whatever. Yeah. So if I have that slide up, I'm unable to do anything else on the background because you guys are gonna see what I'm actually doing.
Okay. Cool.
Okay.
So I'm just waiting for Justin to join in and then yeah. Hey, Sia.
Hi, Sia.
And hi, Dombi. Who is logged in as Tikkun?
I think it's Justin.
Justin is like in a meeting as we speak. He is wrapping up an online meeting.
Can you hear me now? Hi, it's Sia.
Hi, Sia.
Hi,
How are
Sia.
Hi, how are you doing there?
All good. How are you?
Great, thank you.
Cool.
Sia, can you please turn on your camera? I just want to see if do you have an access to turn on your camera?
Okay. No problem.
I'll just turn on my camera.
Okay. Can you see me now?
Yes, but can you try like and just position it? Because now we're just seeing mostly the shelves on top of, yeah, on the top part.
Okay.
And I don't know,
So-
there's something on your right, like something that is black. I think it's on the screen. I'm not sure if it's how you've positioned your camera, but you can't really see your face.
No, really. Now,
Much better.
much better. At least you can. Hi. Let's see if it looks there. I can see. Sure. Okay.
Oh, that is much better, Sia. Thank you so much.
Wonderful. Great, great, great.
I see Dombi is here. Can you please talk
There's some issues, I think, with audio.
with Dombi's audio?
Yeah, it still says it's connecting to audio.
Oh, okay. Let's just give us some time. And then Sia, do you have any presentation?
Yes, I do have a PowerPoint
Okay.
presentation.
Alrighty, I'm gonna make you a co-host so that you are able to share your presentation when it's your turn to present.
Esty? What time are you leaving? Okay, can I leave my stuff here? I don't have.
Justin, is there a way of deleting these chats?
One second, I'm looking into that.
Sorry, guys.
Okay, so I can't delete anything because I only joined now. I just need to change my name because my name is saying Dominique. Okay. And I just want to check. I just want to check some things, guys. I just want to see who is hosts, participants. Okay, so I'm a co-host. Dominique is host. Who is the other Dominique on this call? That's who? Okay, co-host. Okay, oh, sorry, guys. I don't know how to delete the chat when I actually can't see what happened. I'll check on Noctula's side in the interim. Dominique, do you know how to make people co-hosts and that, or do you want me to manage that from my side?
I do know how to, but it wasn't allowing me to earlier. I'll just check that it can now. So just give me a second.
So Dom, what's going to happen is Noctula is going to. Okay, I already am. I'm going to be host, and then any of the speakers that need to, be named or be managed co-host or anything like that, I will then give them that access. I'll give them access and change it to co-host or co-host, etc. And then obviously that means, then they can turn on their screens and they can share their screens if they have a presentation available. Noctula will put up the resting slide so that people are aware that the meeting is when it's in a break period or Q&A section. And then we will also admit people. Everyone that is admitted will be automatically muted. Some of them can turn on their cameras, but we will turn off their cameras if need be. And then once we've done that, they won't be able to turn their cameras on unless any of us that are currently in this meeting who have co-host or host capabilities.
Perfect, thanks.
Cool. So who in here, except because I know Mahop is in here, Noctula, I'm in here, who in here is any of the speakers?
So the speakers are, I'm moderating, Sia, Esther and Elizabeth, Mokoena are all speakers.
So Esther, Elizabeth, Sia, and who else?
I'm moderating.
And you said Mokoena.
Mokoena, yes.
Okay, I'm making Esther and Elizabeth a co-host. I'm making Sia, I think Sia's already a co-host. Yes, he's a co-host, and Mokoena I am making a co-host. Okay, Fantastic. So everyone that needs to be a co-host, if you guys can all, before the meeting's about to start, just turn on your screens quickly so we can all just wave and say hello and see that everything is ready and set up. Okay, so Dom's on. Awesome, nice. Let's see who else the screen is on. Gani, okay. Mokgwape, if you can turn your screen on. Esther and Elizabeth. Okay. Still waiting for Esther and Elizabeth to, let me just check. Ask to start video. I'm just checking if they can hear me. Dom, are you anywhere near them? Oh no, you're in the boardroom.
I'll let me go for a second.
Okay, so Sia, Makwena, nice to meet you guys. You guys can keep your cameras on at all times because you guys are the speakers. Obviously, when you're not speaking, you can stay muted. And then Esther and Elizabeth as well. They can keep their screens on at all times because they are one of the speakers. They will stay muted when not speaking. And then Mokgwape as well, you can have your screen on at all times. Myself, Dominique, Nuktula, the people in the background, we'll have our screens off just so that people don't wonder why there's just some random guy with a mask moving around the whole time. Cool. I'm going to turn my screen off. Esther and Elizabeth, Mokgwape, please keep your screen on. Okay, thank you. And Mokgwape, you are the MC, correct? So, who's the MC? You're on mute,
Dominic.
Mokgwape. Dominique, okay,
Dominic,
cool.
yeah.
So, okay, cool. So Dominique, when you're ready, you can, oh, Lord heaven help us.
Welcome to load shedding.
Okay, Dom, so you can start the thing and myself and Nuktula in the background will start letting people in, muting them, etc. Okay, I'm going to go on mute now. If you guys do need technical support, just message privately, not to everyone. Okay, good luck and have fun.
Thanks. So we're starting.
Yebo.
Great. Hi, everybody, and welcome to the webinar. We have just been load shedded, so South Africa in classic style. So welcome to the webinar on safeguarding and protection. This is a webinar series that we have been looking forward to for a while now. The focus of the webinar series is to really talk about various aspects of safeguarding and protection, and to consider it from multiple different angles. So we've set up 5 different days of webinars. Today is really focusing on what is safeguarding and protection, and from a practical point of view, what it means for different organizations to implement safeguarding and protection within their organizations and within their work. So I'm going to just very broadly give a basic introduction to the webinar and to what safeguarding and protection is. I'm then going to ask each of the speakers to introduce themselves just very briefly. And once that's happened, then I will go on to the actual presentations. Can everybody please feel free to, if you have any questions, please use the chat. We'd love to have questions, comments, and we're going to likely take any questions at the end of the webinar rather than during the presentations. So they will be held until at the end. So from our side, I think that it's important to know that safeguarding is really about how do you prevent and respond appropriately to to any kind of abuse, harm, or misconduct. And it's about protecting the people who we work with, the people in our care, the people who we provide services to. It's also about providing assistance to staff members and making sure that the organizations that we work with and our own organization is safe, and the reputation of our funders is also protected. It's quite an important thing, and it entails quite a lot of different elements. It is about policies and procedures. It's about keeping the people safe. It's about reporting and response so that we know that if something does go wrong, we know who to report to and how to report. And it's about governance and accountabilities in all of our organizations. Now, what happened was we started our own safeguarding and protection project into 2019. And very soon after it started, COVID hit. And so what we found is that COVID is in and of itself the epitome of a safeguarding crisis. Things that staff experience, things that people in the communities experienced were really heightened. So issues of stress, issues of anxiety, burnout, depressive symptoms, organizational stress, people feeling frustrated, easily angered, those kinds of things. And from an organization level, what we really found is that this exacerbation of problems was inherent in the work that happened. And so if there were issues of communication problems in organizations, then that would be heightened during COVID. If people were experiencing burnout or stress and anxiety, that was heightened. Issues of bullying and micromanagement or sexual harassment, all of these things were really, there was a sharp focus on all of these things. And so what we tried to do is to put a series together that could utilize what we've learned, but also what other organizations and other people have learned throughout, not just throughout COVID, but before COVID and during COVID, and how do we move forward from this? What our speakers today are going to be looking at is around issues of safeguarding within their own organizations. We have Sia, who is going to talk about his the experiences of dealing with safeguarding as an organization. We have Esther and Elizabeth, who are going to talk about drafting policies and procedures and implementing them in the organization, with particular focus on how this is done, on COVID. And then Mokoena is going to be looking at Afrika Tikkun's response to safeguarding and protection, and how Afrika Tikkun has looked at it as an organization. So I'm going to, in that order, ask each of the speakers to introduce themselves, and then I'm going to hand over to Sia.
Okay, thank you very much, Dominic. Good afternoon, everybody. So my name is Sia Kwenduna. I work for VPUU as a human resource practitioner. I've been in this organization for quite some time, VPUU. Before that, I worked for another organization called Habitat. Yeah, thank you very much.
Thank you, Sia. Esther and Elizabeth.
Hi, everyone. I am Esther, and I'm the HR officer for Afrika Tikkun. And I've been with Afrika Tikkun for 5 years now.
You are muted. Hi, everyone. I see I was muted. My name is Mokoena Ramoroka. I'm a social worker first, and I'm also a general manager for Afrika Tikkun, Wings of Life in Deep Sloot. And for many years, like Sia, for many years. Thank you.
Many years. Okay. Good afternoon, everyone. My name is Elizabeth Ramatepa. I'm working for Afrika Tikkun as a training facilitator. And I think I have 5 years now with this organization. Yeah. Thank you.
Thank you. So Sia, would you like to go ahead?
Yes, I'll go ahead just now. Thank you. Basically, I'm just trying to share my presentation. Can you see my presentation?
We can see you.
Okay.
We can't see your presentation yet. Let me.
No wonder. So you still can't see it? Can you
Yes,
see
we
it?
can see it. Yes.
It's on
Wonderful.
the screen. See.
Is?
Yes, we can see it. Go ahead.
Okay.
Mhm.
All right. What I'm going to be talking about is earlier on explained by the MC is a safeguarding. Before that, that's to talk about what are some of the challenges and measure that we have put in place as an organization, VPUU, since the start of the COVID-19 last year. So if you just see on my background there, information, what I'm trying to say, we know that COVID-19 is not a South African issue, it's a global matter, and it's got a lot of challenges that is bringing in the workplace. But it's not only challenges, there are also opportunities, those who can explore the opportunity organization. It's not all bad that COVID-19 brought. It also made people who are decision makers to be broadened, to think out of the box on how to safeguard the employees. What are some of the innovative things that can be bring in a workplace? So last year, when we first experienced the COVID-19 as an organization, we had to put a number of measures in place in order to safeguard our employees or to support our employees when we had a hard lockdown. One of the things that we did, as much as we allow some employees to work from home and provide them with various tools, working tools such as data, cell phones, laptops, etc., etc. We also realized that not everybody was going to suit the situation of working. There were certain staff members that we had to make sure that they are under those difficult conditions come to our office to be able to work. For instance, the receptionist, your admin staff. So what we did to safeguard them, we had to provide a transport for them, for those staff members like a reception to come to work and all that kind of thing, taking into consideration the safety protocols. So it was a very good thing for an employee. It was highly appreciated. We also had to make sure that we had a WhatsApp group to be able to make sure that we connect with each one another, to support one another while we're working from home, so that at least you know. And we also established what we call it an attendance tracker. So in the morning via WhatsApp, you would be able to say, I am present via WhatsApp to your particular groups, you would be able to communicate with your other staff members, say, I'm present, I'm still fine in your department, so that people know that SIA is on duty, it's fine, nothing affected, all that kind of thing. And also a way of trying to give a moral support to one another, because it was a very first time, a very first experience to most of us to be working from home. So it was kind of, we needed that connection. Obviously, we also had to make sure that people have a funeral cover, and we also provided a counseling section, a facility for counseling section via FAMSA and an NGO that we're working with, and via Momentum. And because of that, we also have to make sure that we develop a number of policies. To name the list, these are some of the policies that we developed during that time that were related to POPIA, protection of personal information. As you can see, the list with the data protection, the clean text policy, the password, etc. We also had to make sure that we develop addendum, employment contract. So these are some of the policies we had to establish. There were a number of challenges, in particular last year and this year, because you know that this year we had also a COVID-19, what to call it, a level that was in a level 4, early in January, that level 4, early in January, something like that. So one of the challenges, we lost two staff members, unfortunately. Also another challenge, because of the nature of our business, we had to engage with community structures. So it was so difficult for us as an organization that is dealing with local stakeholders to engage with stakeholders. And it was also very risky to deal with staff members, to deal with community members at times, because at the beginning, they were not very much taking the protocols, safety protocols. It was also a challenge for us. We have what we call EPWP workers. I'm sure you know, some of you, about that program. Volunteers who work with us like a month on a month. Who have contract with us for a year, 12 months. So those are the number of people that was very difficult to control or provide the space for them during the time of those levels that were challenging, and during the time of COVID, hard COVID-19 last year. We are unable to provide with space, especially when it's raining. It was also difficult to get the timesheet from them, especially last year, because last year it was quite very tense situation. But we needed those timesheets because we had to provide the report to the city of Cape Town, who was funding those EPWP. So when we started this process of working at home, we realized that not everybody was productive, because people were having a challenge online, because you know that Zoom or Skype, those are the things that were not very common when we started there. So people were very much having challenges on this system, on this platform. So as a result, if we have a meeting, we had to take a lot of time. Other people will have a connectivity problem, things like that. Those were some of the challenges. We also had to develop policies that are very much related to the safeguarding, like for instance, sexual harassment, disciplinary, etc., etc. So these are some of the policies. Some of them we had to kind of summarize them so that all staff members can have a quick way and to find a way of encouraging staff to access them. We are working very closely with Mahlope about developing these policy summaries. So as you can see there, where we are in terms of sexual harassment, policy, disciplinary policy. So the first priority were those ones that are related to safeguarding, and then go to the rest. So that's another process that we are. So all I can also mention is that as much as the situation was very abnormal because of the lockdown, in particular last year and early this year, fortunately, from our VPUU side, I can attest of positive things. You know that many organizations retrench staff, many organizations, staff members had to work short time. Unfortunately, from our side, none of the employees were retrenched as a result of the lockdown. There were no short time. People were working at home and were paid full time. Even though they were working from home and not that productive because there were no events that were happening. Also, with the board managed also to approve the inflation-related increase as well as the annual bonus. So those the positive thing that say, thank you, Lord, we've managed to do those things to our staff. I said earlier on, it wasn't all bad. And I can always say that, as you can see from even when people are commenting, COVID-19 also brought some things for us to learn. Like I said, even now we are not on a tough lockdown. Online meetings becomes now like a normal business. For instance, even now, maybe if COVID wasn't, we never thought of having this visual workshop. So there are many things that are happening that we've learned during the lockdown and we're challenging. Community participation is one of the departments that is engaging with communities. They also try to be innovative and come up with finding other ways of dealing, engaging with communities because there was no need to contact any person. But unfortunately, it didn't work. It was realized, it was learned that even though we try to introduce other mechanisms like organizing data for the stakeholder to be able to organize meeting, etc., or things to make sure that they are engaged with community in terms of when they need to distribute vouchers. But unfortunately, those things didn't really, we're not really working for the community, but at least we learned something that we need to enforce. So the other lessons that I can also attribute, other people also struggle with communication and distraction from working from home. Many people will also learn that many people, because people are working from home, they were able to be productive and work longer hours. It is a common knowledge that obviously you can also reduce the cost if you are working from home, if your staff members working from home. Why is because at times you won't need to rent a big space that you would need. So because of staff members, they've got offices from their home, there are certain things that you won't need to buy. I'll give an example of milk, because we've got fewer staff members, other than the rest of staff members are actually working from home. And also there's things like sick leave. People won't take so much sick leave, which is costly to the organization if they're working from home. A paperless environment, obviously. We also learned that digital is very important, people to be able to use, not to rely on a paperwork. So we also learn that, and we also need to practice other. As a result, our IT department is working hard to come up with many things going forward, because that's the future. COVID-19 has forced all of us in the world to think about future. The revolution, I mean, the technology that was kind of limping, now COVID-19 is trying to accelerate it. The organization need to think about future and not backward. So those are some of the lessons that we have learned during the COVID-19. And like I said, we are working very hard as an organization with this organization to make sure that we educate our staff members about various policies that are related to safeguarding, as I've mentioned earlier on, the sexual harassment, everything we do. When also we recruit, we also have to make sure that we screen people, we scrutinize people, make sure background check, things like criminal check that is in place. We do criminal check for people because they work with children, all those type of things we do reference check. So those are some of the things that we are doing as an organization in trying to safeguard our employees in our organization. I think, like I said, it was just for me to sum up some of the things. I'm gonna pause for now. Thank you.
Thank you very much, Sia. That was very, very informative, and I think it gives a really good overview of how safeguarding in VPUU has gone over the course of the last year and a half or so. I'm going to hand over to Esther and Elizabeth to talk about the Afrika Tikkun experiences, and then we'll take questions at the end.
Linda.
Hi, everyone. Can I start? Mr. Mokoena, were you saying something?
Yes, please go ahead.
Oh, okay. All right. Thank you everyone for giving us this opportunity to share our experience around COVID-19 and safeguarding. So on the 15th of March 2020, COVID-19 was declared a national disaster, which is defined in Section 1 of the Disaster Management Act of 2002. The COVID-19 made headlines around the world. Reliable information was made available by the World Health Organization on the internet. And however, there was a great deal of fear, panic, and speculation when we first experienced it as an organization, as well as a whole country of South Africa. What COVID-19 meant for AT, as most of the organization, Afrika Tikkun had to ensure that it follows all the COVID-19 national regulations and code of practices as provided by the World Health Organization, Occupational Health and Safety, and National Disaster Management, which was amended from time to time as the outbreak changes. This meant we had to ensure that there is a proper COVID-19 guidelines and protocols in place to ensure that the work environment is safe and there is a minimal risk of contracting the virus for our employees, beneficiaries, clients, and the rest of the public society. This required the organization to have administrative measures in place. This is COVID-19 policies and procedure documents to all its operational sites to ensure compliance. All other procedure documents had to be made relevant to the nature of the organization we are. For an example, because we are classified as essential workers, we had to use code of practices for essential workers to guide us accordingly. Communication and keeping everyone informed in the organization. So the organization had to ensure that there is proper communication and training to its employees to all health and safety directives provided by the government. This is the national state address and how they will be implemented across operational sites. This was done through means of electronic communications from our CEO to our distribution mail list and through our GMs, head of departments, and managers. This included communication around limiting numbers of employees at the workplace where departments had to work on rotational shifts. We also had to make awareness of the COVID-19. So there was posters relating to COVID-19, which were displayed accordingly at each site. These posters are health and safety posters such as hand hygiene, no mask, no entry posters, and signs and symptoms of the virus, etc. COVID-19 education. I will leave it to Sis Elizabeth to take us through COVID-19 education for our staff members.
Okay, thank you so much, Esther. As Esther was saying, Thank you so much. I'm just going to take us through the education. As I was saying, my role is to educate and facilitate all the policies in Afrika Tikkun. So immediately after the organization has realized now the people are very confused about the COVID-19, the organization realized that they have to educate the employees as they were supposed to work as the essential workers. So we have to take them through the education on how can we manage or to reuse the virus in our premises. So we did go under COVID-19 education by where we were teaching our employees about the signs of COVID-19, what can be the symptoms, hygiene keeping of surface and wearing of mask, coughing etiquette, and how and when to report. And remember, when this COVID-19 occurred, there was a lot of myths going around us, and then the people are now confused on what to believe and what not. So those are the things that we go through with our employees, and also the facts about the virus, etc. So I think, no. Yes, so sorry for that. Yeah, as we all know, the virus actually, it affects our respiratory system. So we encourage our employees to use a cough etiquette, of which we encourage them, or when they are sneezing or coughing, we have to cover our mouth and our nose with a clean tissue, of which after using we can throw it away. We don't use it 2 times or more than 1 time. We only use it once and then we throw it away. And also, if there is no tissue, sometimes we can use our elbow. We can sneeze or cough to our elbows. And also after coughing, we encourage our employees that washing our hands is a mandate in Afrika Tikkun. Also cleaning the surface that we are working on, the objects, also to make sure that every time we sanitize the surface and the object that we are using and then we also use the alcohol-based hand cleaners if you don't have the access of water, because sometimes we will find that you are in the place where you can't find water anyway, but we encourage them to use a sanitizer, which is alcohol-based hand cleaner. So that's all what we have learned. Also, a hand rub, how to hand rub their hands. We are teaching them we have to apply, how to apply what do you call that thing? I forget the name of a hand sanitizer, because some were struggling. They were just putting it in the hand, in the middle of the hand, and just rub, not knowing what they have to go through. All the hands, putting the other hand, the left hand on the top of the right, and then make sure they rub through all the tips by the edge of the fingers, and on top of the left and top of the right, they have to correspond the hands like as I'm doing. And also to make sure after rubbing, they also have to make sure their thumb have to go on top, changing the side from left to right and then from right to left. So those are the things that we're sensitizing our staff with, because people were struggling and then people were confusing also. But what we were encouraging mostly is a hand washing, because I think hand washing was the easiest one because now everyone is unable to get some water and soap, and then we make sure all the bathrooms of Afrika Tikkun, they are always the soap and the tissues in the bathrooms. So yeah, I think also, yeah, I think that's fine. You can just take it from there.
So I will carry on from Sis Elizabeth. and speak about the COVID-19 procedures and protocols in Afrika Tikkun. So in all our sites, we had our COVID-19 compliance officers who work closely with our health and safety coordinator to address any concerns from employees and to keep them informed on any changes to the rules and regulations around COVID-19 in the organization. Our compliance officers also ensured that there is strict adherence to the standards and health protocols relating to COVID-19 at the centers. This included, but not limited to, COVID-19 temperature screening and making sure that there is completion of registers and registers are completed correctly and accordingly by employees and the rest of the public, as well as washing of hands and sanitizing of hands, social distancing, wearing of masks, and making sure that there is provision of facial masks. And all these measures were strictly monitored by our 360 social support services. And managing sickness and transmissions. When it came to managing sicknesses and transmissions, employees who were sick or showing symptoms associated with COVID-19 were set to, they were set to take sick leave and or annual leave according to the Basic Conditions of Employment Act. However, with our employees, they received special leave for the isolation days that they had, or the time that they experienced any signs and symptoms of the sickness or having to be tested positive on the virus. And however, in relation to managing sicknesses and transmissions, is that we also had to ensure that our surfaces and the work environment are properly sanitized to make sure that there is no transmissions at all in the working space. And what we also offered our employees in terms of support is that we will do sickness monitorings. This included us having to check on our employees and as well as offer them support, such as mental health support, which was mainly done by our 360 SSS department, and as well to see if we can assist them accordingly as well with the basic medication of boosting their immune systems. As well as testing. Testing was also arranged for employees with signs and symptoms through one of the organization the business is in partnership with, which is Riza Babuile. So our staff members had access to testing freely at this business at Riza Babuile. And with risk assessments, we had risk assessment where we reviewed our controls and measures around COVID, which we did with our sites, where our department participated in a risk assessment review to identify if there is any possible risk which should be looked into. And this involved all the departments identifying possible COVID-19 risk that can affect us, and also identify possible solutions and controls to be in place to minimize such risks. And in closing, I would like to say COVID-19 has been a very difficult experience for the entire country, where most people lost family members and their loved ones. It brought fear and anxiety to everyone. However, as an organization, we still remain strong in ensuring that we are able to continue with life and serving the community and achieving our desired goals while observing the safety measures and protocols of COVID-19. Thank you.
Thank you so much to Esther and Elizabeth. To all people joining the webinar, please feel free to put questions and comments into the chat, and we will deal with them after the final presentation, which is Mokoena. And I'm going to hand over to you, Mokoena.
Hi, Dom, thank you very much. I was still dealing with the technology side of it. I'm just checking if everyone can see my screen from your side.
Yes, we can. Thank you.
Thank you very much. Thank you. I'm going to, Dom, I need to say the presentation that was done by Esther and Elizabeth pretty much address what I'm going to be presenting here. And then you will see that their responses was actually in responding to the issues that were identified during the sessions that we did. Okay? And then this report actually September 2020, and this the five of our centers in Orange Farm, Diepsloot, Bramfontein, Alexander, and the one in Fuleni. These findings were actually captured in one report to represent the whole center. If, like Sia did give you a background about the staff debriefing, how it came about. Yeah, the staff debriefing came as a response to the hardship that our staff members, not only them, their families, relatives, and their loved ones experienced during the hard lockdown, and as a direct result of either being affected or infected by coronavirus within the organization. Let me deal first with the two terms there, infected and affected. When Corona came, nobody was spared. There are those who directly and stay at home, but there were infected by Corona. Some lost their job. Some, there was just a lot of hardship. So it was either they were infected or they are affected by coronavirus. And then also that we had to leverage and see exactly where can we coin this. And I will give you the description of two things that were really evidenced through the time, the trauma and the mental health. And we had to coin everything around that to see whether we are going to respond and do the correct things. And then as you can see, trauma, the response to a deeply distressed or disturbing event that overwhelms an individual. And it also affects their way of coping, and it brings along the feeling of helplessness, and it brings with it a lot of emotions and hard experiences as well. And then we also had to visit to say, where are they, emotionally, mentally, and so. And for that, we used World Health Organization explanation of what mental health will mean, so that when we start together the different experiences, we should see the level where mentally our people within the center and staff members were affected. And World Health Organization explains mental health as a state of well-being, in which an individual realizes his or her own ability and can cope with normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. You see, when you look at that itself, and then you start to ask, why did we even look at our work environment? Because the element of working productively was at play when people started to question as whether they will still be working after the corona. The stress was too high. And as whether they can still fund, and as whether they will still be able to contribute to a bigger community. Because a human being is a social being with people. So you can't function alone, that you need to interact with other community members and as well as family as well. And then those two descriptions that I was looking at, take notes here, were shared with staff members so that when they start to share their experiences, they should actually know where they coming from and what the explanations are saying. Yes, you're saying, are you coping? Then you know that you've got a greater understanding of what World Health Organization talking about when we say people can cope under normal stresses, and so that this should then, there were sessions held, like I said, in my staff members were all infected. And in terms of affected, there were some tested positive, and because corona, going to put it in the third person, that I was also concerned to say, will I still be alive when all these hardships are still going on? So that element of fear, and for one finding themselves in having to deal with a lot of people, brought along a big fear. If I may share with you that during the lockdown, when people were sent home, when school children were sent home, that is to respond to the needs of the people because of the kind to make sure that people are well cared for. Hence, we embarked on a rollout of food parcels in the entire community of Diepsloot and the neighborhoods. And some of our staff members were not spared. They lost family members and relatives. And then, you know, usually in our different cultures, people who hold a certain significance to your life, when they passed on, the last respect that you want to give them is to go and bury them. People unable to
Aquena?
that is bringing a lot
Aquena,
of
your connection is quite bad. I'm going to just pause your presentation.
Also, some of them who were able
Okay. Hi, everybody. Unfortunately, the connection was quite bad, and we are in the middle of what is now stage 4 load shedding. So I imagine that it's not going to be an easy week for anyone. I'm going to open the floor for questions and comments. There was a question from the floor earlier directed at Sia, asking Sia, from your side and from VPUU's side, how did you help your staff cope with the loss of colleagues? I'm also going to open up additional questions for Esther and Elizabeth. One being, how did you deal with the resistance to training and to policies, if you experienced this within your work, when you asked people to adhere to policies and to be compliant and were given training? Was there ever resistance, and how did you deal with that? And then just to ask more broadly, for all of the speakers, I think that one of the things that happened, particularly in the hard lockdown, was issues of fear and anxiety, and also of issues of grieving. I think that what many organizations found is that employees felt heightened senses of fear and anxiety. So for each of the panelists to just consider how you dealt with issues of fear and anxiety, but then when employees did experience loss, and funerals weren't open to everyone in the community, as well as people not being able to attend to sick family and friends, how did you deal with issues of grieving within your organizations? So I'm going to start with Sia and then move on to Elizabeth and Esther. And if I can get Mokoena back on the line, then I'll ask him again.
So to answer your question, it was very difficult to help the staff because one of the death happened at a very at the beginning of the lockdown. So at that time, people were not allowed to gather. Things like going to visit the family, it was difficult because in our normal practice, when somebody is facing a challenge, is to visit their family and do a special prayer and all that kind of thing. But at this particular one, it was very difficult. It was just a matter of saying those who were very close to those people. There was this facility that was available online of counseling. And those people were very working close with those people. They can phone momentum for that session of counseling or FAMSA. And obviously, people were trying to comfort themselves by expressing their condolences via WhatsApp group. So the situation was not normal because, like in my culture, as was said before, you can only be settled once you visit the family that is aggrieved, to go and do special prayer, all that kind of thing, including the funeral at the time of funeral and memorial service. Those type of things, they are very helpful in our culture, but it was very difficult. So I cannot say it was a perfect. We could not find any perfect way of dealing with it. I'm not sure if I've answered your question.
Yes, thank you very much.
Okay.
So I'm going to open the floor for Esther and Elizabeth. The question again for you is around how did you deal, if you experienced resistance to training and the policies, how did you deal with this?
Okay, so to answer that question would be that because we had policies and guidelines, and all these documents were assisting in guiding employees as to making them understand, even through our educational trainings with Sis Elizabeth, we would make them aware as well as to the circumstances of not following these rules and regulations. So they would understand it from a point of our guideline documents to say that it's an offense to not report if you do not if you do have the signs and symptoms, and put other people at risk and come to work with such signs and symptoms, and then to as well make them understand what is then the action or the next steps towards such an offense. So our guidelines, so our documented procedures and guidelines would actually outline all that to make employees understand of any negligence or anything that will come out from them not adhering to these rules.
Thank you.
Thank you. I hope I answered that one. What is the next question, Dominic?
Was there enough resilience? I'm not sure.
So the next question was also about the fear and anxiety within the organization, which I think that Mokoena might respond to as well, and as well as how the organization worked around grieving, especially since people couldn't go to funerals or attend to their sick.
Yes, from my side, I would say that it was quite difficult because, it's very difficult to tell a person not to go to KZN because their mom passed away, because KZN is reported as a high risk at that time. So it was a very difficult situation. And I think the only thing that I did on my side was to guide the employee in terms of making sure that they adhere to the protocol, because some of the things we necessarily did not have control over. It was the measures that were put on by the government. So it was then a matter of getting assistance in terms of dealing with that. And we had our 360 social support services that would assist with such issues. But at some point, we did not have control on certain controls that were put in by the government. Thank you.
Thank you. Elizabeth, do you have anything to add?
The only thing that I can add is where you were talking about the resilience, because yes, as we were saying before, remember when this COVID started, there was a lot of myths coming around, and the people were actually not wearing masks in a proper way. Some, they can just wear the mask, but not covering the mouth and the nose. And then when you ask, why are you wearing the mask like this? They can tell you, I can't breathe. If I cover my nose, I can't breathe. So as Esther was saying, there was a policy of which it was a must, it was a mandate, trying to show them it's a mandate for us to make sure we keep each and everyone safe. Because if we don't wear the mask properly, that means it's like we are not wearing the mask. If we can wear a mask and then just put it under your chin, you are the same as the person who is not wearing a mask. So we are making sure that we compel them. Actually, it was a must to make sure they understand the importance of covering our mouth and our nose, because people were not really happy about it. But I think Esther also make it clear where there were policies that were compelling them to show them how the importance of wearing a mask in a proper way. Thank you.
Thanks very much. Yes, Mokoena, please go ahead.
If I may follow in in responding to your question as well is that our staff members had full access to 360 social work services by accessing counseling and support. But that came with a frustration that usually we use our stakeholders, and in most cases we're using the South African Depression and Anxiety Group, which that service was affected by Corona as well, and people had to work from home and then use what we call online counseling that to most of our staff members they were not used to as compared to face-to-face. But really it was very difficult because sometimes one could feel that having one social worker at that time in an organization was not sufficient and was not serving the need that was existing. I thank you.
Thank you, Mokoena. I know that you were unable to complete your presentation, and I'm not sure if it would be worthwhile continuing now or if we should just continue with questions and comments. Mokoena, I'm not. Would you like to continue your presentation?
I may get direction from you, but otherwise I was left with only questions.
Would you like to finish the last of it?
Okay, let me just deal with the last 3 slides and then we are done. And then also I spoke about element of fear that was brought to staff members, more especially when we introduced rotation, that staff members had to fear that, are we losing our jobs? You see, that was one area that really affected people in a negative way. Also that, you know, people are connected where they stay, their relatives, and then they see them going out of job. And then it was also a fear factor to them because now they were not clear as whether this rotation that they are on is gonna bring bad news to them. And then final slide, these were some of the discoveries that we experienced. That people's stress and traumas must not be downplayed. And people suffering, much as they suffer in silence, we all the time need to respond to that. And then also that there was a realization that some people thought they were suffering alone. And when they shared their different experiences, they started to realize that they were not suffering alone. There are other colleagues that were really not coping at all. And then after all these things were done, and then it was, what was left was to present this to the HR. As you could see that the HR people had to come with a lot of policies around how we're going to do things going forward, and also how to respond better to these hardships that people experienced. And also that staff wellness within the organization became a big deal, and it's something that we will continue with all the time, because Corona, we are here, we are not sure to change a lot of things after that. Thank you, Dom. That concludes my presentation.
Thank you, Mokoena. So I am aware that we've had some indications from some. Can you hear me? We have had some indications that people are struggling with power outages. So I do know that that is becoming a little bit of a problem. If there are any more questions or comments for the panelists, please feel free to ask them now. All right. So given that we are into load shedding stage 4, and I don't see any more questions. If there are questions, you can feel free to send them directly to ourselves at Afrika Tikkun, or type them up on the chat. And in the absence, I'm probably going to close this webinar. Okay. Thank you everybody for joining, and thank you very much to the speakers. I think that it was very informative, and I want to commend everyone on the work that they've done over the course of COVID in keeping their organizations and their selves and the people that they work with safe. So thank you all to the panelists and to everybody who's joined. And we look forward to tomorrow's session. Tomorrow we are, Sia, you have a hand? Oh, thanks. Tomorrow we are going to be looking at compliance versus culture. So looking at how we can transform organizations through policies and procedures. We will be having people from Kulisa Social Services, we have a speaker from the UK who is she works around providing grants on safeguarding and protection, and from corporate. And we look forward to tomorrow's webinar. So everybody who can, please feel free to join, and we will see you then from 2 o'clock.
Thank you so much.
Thank you so
very
much. Take care of yourselves.
Bye.
Thanks. Bye.